I'm Dr. Tom Flaherty, Medical Director of BioDigital, the world's first 3D interactive, cloud-based human body platform. And today, I'm going to be talking about empowering patients using 3D technology in the telemedicine age. But first, some sobering statistics. Only 1 in 10 people in the United States understand the health information that they receive. At the same time, medical information is estimated to double every 73 days. That's this year in 2020. If you compare that to 1950, it was estimated that medical information would double every 50 years. And that doubling time is only going to get smaller and smaller as the years go by. The result, as you can see by this exploding head emoji, is incredibly low levels of health literacy in the United States. Low health literacy can loosely be defined as understanding one's own body, one's own health, any diseases you may have, and treatment and options available to you to improve your health so that you can make informed health choices. What's the result of low health literacy? Well, it really is a tragedy because low health literacy is linked to higher risk of death and more emergency room visits and hospitalizations. It's also incredibly expensive. People with low health literacy have a higher utilization of expensive services. The cost of low health literacy to the United States economy is up to $238 billion annually. That's up to 17% of all personal healthcare expenditures. Put another way, that cost represents an amount equal to the cost of insuring every one of the more than 47 million Americans who lacked healthcare coverage back in 2006. So how do we improve health literacy? Well, one of the ways is to look into the booming telehealth industry. You can see the stat right here is telehealth visits grew 4,000%. Anything growing 4,000% is a huge amount. If something grows over 4,000% in less than 1.5 months, that is staggering. This data comes from a recent study at NYU Langone Health that showed that their hospital network non-urgent virtual health visits grew by 4,345% in daily averages between March the 2nd and April the 14th. That's less than 1.5 months. That's this year in 2020. Now, obviously a lot of that growth is to do with COVID, but many experts agree that that growth in telehealth will remain constant in a post-COVID era. Telehealth itself can improve health outcomes for patients. A recent Journal of Medical Research, of Medical Internet Research study showed that with telemedicine, patients had 38% fewer hospital admissions, 31% fewer hospital readmissions, and they were 63% more likely to spend fewer days in the hospital. They were also more engaged in their healthcare. This is also good news, by the way, for the healthcare provider, because there's now billing and reimbursement parity between in-person visits and telehealth visits, which there hasn't always been. So this provides an unprecedented opportunity to empower patients to better understand their health conditions virtually to improve health outcomes. Before I get into how exactly I think the best way to do this within telehealth visits, I want to talk briefly about the difference between speaking to your healthcare provider on the telephone, not seeing them, versus doing a telehealth consultation where you have a video of your healthcare provider and vice versa. Here I really think the Chinese proverb rings true. I hear and I forget, I see and I remember. So studies show that seeing rather than just hearing not only improves comprehension of those trying to understand, but also improves memory. And I want to draw your attention to 2 studies in particular which talk about this. A University of Iowa study found that when trying to remember sounds versus colors that study participants have been exposed to, their memory decline was much greater for sounds. And then looking at a University of Massachusetts study, they found that creating visual explanations improved learning, especially when communicating scientific topics. They were looking at STEM subjects: science, technology, engineering, mathematics. This is a STEM subject, this is science, this is healthcare, this is medicine. So there's a great need for clinicians to use tools that add value to video-based consults, tools that increase patient health literacy, engagement, and compliance, and can help educate patients to make informed choices. Before I show you this 3D interactive technology that I'm talking about, I want the studies to do some talking for themselves. This was the meta-analysis conclusion of 3D visualization studies. They're actually 3D healthcare visualization studies, so very specific, looking at them versus traditional teaching methods in 2D and so on. And this was the conclusion. 3D visualization technology, by the way, this was for 36 studies they looked at. 3D visualization technology yielded higher factual knowledge, significantly better results in spatial recognition, and a significant increase in user satisfaction. That can be boiled down to more informed and knowledgeable patients and happier patients, and therefore you can increase health literacy and improve health outcomes. There are two other conclusions that I'd love to draw your attention to based on other studies out there on 3D interactive technology. And some of these studies I want to add actually used the 3D interactive technology from the BioDigital Human. So first of all, written information provided to patients without direct interaction by healthcare providers has little, if any, impact on health outcomes. So it's that key component, it's interacting with patients. And 3D visualizations can reduce the amount of time it takes to learn, as well as the proficiency of what is learned. So you may actually save time, as well as learn things better. So this is the BioDigital Human. This is an example of 3D interactive learning. BioDigital is the world's first cloud-based human body platform that for the first time allows patients and professionals to see inside a virtual model of the human body, enabling patients to learn about their bodies, diseases, and treatments. This cloud-based architecture makes the technology accessible anywhere in the world on any device. So here you see a bunch of different devices. And I just want to be very clear, you don't need a fancy headset like a VR headset, although it does work on that. It works on virtual reality headsets, on augmented reality headsets, but you just need your cell phone or a tablet or a computer, and it works on existing technology. How might this work in the virtual consultation, in this telehealth consultation? Well, here you have a healthcare provider who's obviously on the computer screen. They're interacting with a 3D interactive model here, a biodigital model, I believe that's a stroke model. And the patient is obviously sitting, looking at this consultation and interacting with the doctor. The doctor or nurse, a practitioner or nurse or any healthcare provider can then, during the consultation or afterwards or before, send the actual 3D interactive visualization to the patient just in a couple of clicks and send a URL. So we know that telehealth video conferencing platforms, they're well established, but now it's time to port the 1,000-year-old reference models used during in-person visits into the virtual world. We need to establish a new way to convey complicated disease and treatment concepts to patients. Interactive 3D medical visualizations designed to help patients understand their diseases and treatments will become this new gold standard. Now, I just want to give you an example of a healthcare provider, myself or otherwise, explaining to a patient they've just been worked up and it's found that they have aortic stenosis, for example. I'm going to be explaining, give an example, as if I were explaining to a patient what aortic stenosis is and one of the treatment options available to them. So this is a 3D interactive model of the heart. I'm just moving it around using my mouse, and I can click on various things and I can interact and I can send this exact model to the patient. So this is the left ventricle, the big pumping chamber of the heart, and it pumps blood through the aortic valve to the aorta, the biggest blood vessel in the body, which supplies your body with blood. Now, I'm just going to zoom us into that valve, the aortic valve, and you'll see it's right here. It opens and closes, but sadly, it's got some calcifications on it, and that can lead to a narrowing of the aortic valve, which, as you see here, you see how it doesn't open very much. If you look at the pulmonic valve here, it opens nicely. It doesn't have any calcifications. So I'm actually going to pause that right there, and you can, if you'd like, you can standardize this, and you can show the patient, let's say the patient actually didn't have calcifications, they had a bicuspid aortic valve. So if you don't know what a bicuspid aortic valve is, let me show you right now, because this is how I would explain it to a patient. A normal aortic valve has 3 valve leaflets. You got 1, you got 2, and then you got the third one here. So look, 1, 2, 3. These are the 3 valves. It's kind of like a Mercedes sign. However, something that can cause aortic stenosis, aside from these calcifications, is a bicuspid aortic valve. So that's when you have two valve leaflets. This is one valve leaflet, and this is the second valve leaflet, 1, 2. So you can customize this to tailor it to your patient's needs. And then, of course, through shared decision-making, you want to explain to your patient, whether there are any medications that can help with this, perhaps any treatments or procedures. I'm going to give you an example of TAVR. So as if I were explaining to a patient. So TAVR is a slightly newer way to replace an aortic valve. It stands for transcatheter aortic valve replacement. It's different to the traditional method, which was opening up the chest, surgical aortic valve replacement. And it's less invasive. And so again, here you have the heart, here you have your big left ventricle, the pumping chamber, and you'll see here's your diseased valve. And you'll see a very narrow plume of blood going through this because you have stenosis, a narrowing of the aortic valve. So TAVR, transcatheter aortic valve replacement, can be a procedure to replace this valve. And what happens is you minimally invasively go through your groin. This is the femoral artery. I'm just going to click on it right here and zoom you in there. And this catheter is threaded through your groin, and it goes all the way up to your heart, which I'll zoom into right now. That catheter goes in to right by where your aortic valve is, and it places a synthetic aortic valve in there. You see how it pushed your aortic valve there to the sides, and now you've got this synthetic valve which sits in there. And for the sake of brevity, I'll just skip to the last chapter where you can see this synthetic valve sitting in place of the aortic valve. And you can see you've got a nice wide plume of blood going through there instead of that narrow plume, because it's opening and closing nice and widely there. So that's just an example of how you could explain to a patient one of the treatments to treat aortic valve stenosis. And obviously you would want to go through the risks and benefits of this versus traditional surgical aortic valve replacement, medications, and so on. But it'll all help with shared decision making. So what are the benefits of using 3D interactive technology in the telehealth consultation? Well, there are three main benefits, I think. As visits go virtual, they provide more incentive to use video so that healthcare organizations get reimbursed the same level as in person. So I mentioned the parity now between reimbursement and billing between in-person visits and telehealth visits. Secondly, they drive patient engagement, which is shown to improve compliance and therefore lowering healthcare costs, and most importantly, obviously, improving patient outcomes. And thirdly, meeting the Affordable Care Act quality improvement and shared decision mandates. I briefly touched on shared decision when I was showing you the 3D interactive model, and it's all to do with that so that you make the decision with the patient as opposed to for the patient. In the BioDigital library, there are hundreds of models. I think there are almost 800 different models now. I showed you two. I showed you aortic stenosis and TAVR, transcatheter aortic valve replacement. But there are hundreds of models that would be available to you. And I also want to mention that they can be deployed into any current learning management system, any website, any software, even EHRs like Epic and so on. Easily deployable, very nimble. So to conclude, in using 3D interactive technology, you're empowering patients in the healthcare setting. You're more likely to get healthier and happier patients and happier healthcare providers. We've seen that there's value that's been recognized in the physical space. Here you see a healthcare provider interacting with 3D interactive technology, biodigital technology, at the in-person visit, at the point of care. But as the world moves virtual, we believe that there is incredible additional value and opportunity in moving the technology to telehealth. If you have any questions at all, please don't hesitate to email me at tom@biodigital.com or go to our website, biodigital.com. Feel free to set up an account. Thanks.